Hello everyone. In this video, we will discuss about GPAT 2024 MCQ. What is the question? Which of the following is partial fatty acid oxidation inhibitor? Okay. First question. So in the body, all organs utilizes the glucose. In the fatty state, all organs utilizes the glucose except one organ. What is that? Yes, that is the heart. In the fatty state, all organs, even brain and everything utilizes the glucose, and this glucose oxidizes and produces the ATP. But heart, what is it doing? Heart taking the fatty acid, and fatty acid will oxidizes and produces the ATP. But what is the difference between the glucose and fatty acid? Fatty acids, glucose requires the less oxygen, but fatty acid requires the more oxygen. With less oxygen produces the ATP, and fatty acid requires the more oxygen produces the ATP. Okay, then the heart is functioning. Now the problem is what? Let's say this is the heart and this is the coronary artery, and through the coronary artery supplying the blood to the heart. Let's say hypothetically, so the heart is healthy and through the coronary artery we are supplying the 100 ml of the blood. Hypothetical value 100 ml of the blood we are supplying, and through this blood oxygen we are supplying to the heart, and this oxygen utilizes the fatty acid, produces the ATP, and the heart is working. Now what is the problem? The problem is in the coronary artery there is the plaque deposition. Will I able to supply the 100 ml of the blood to the heart? Answer is no. Now instead of the 100 ml, how much ml of the blood is supplying here? 50 ml. So heart is receiving the 50 ml of the blood, and due to 50 ml of the blood, heart is receiving the less oxygen. If the less oxygen is receiving means the produces the less ATP. Due to less ATP, heart is not working properly. So this condition only we call it as the angina. What we call this condition? This condition we call it as the angina pectoris. The person start getting the symptoms here. Due to less supply of the blood to the heart, that can lead to the less supply of the oxygen and less production of the ATP, and the heart is not working properly, we can get the symptom. This condition we call it as the angina pectoris. Now what to do? So what we said? We said to the heart, stop using the fatty acid. Why we said to the heart to stop using the fatty acid? Because fatty acid requires the more oxygen, but we are not receiving the enough blood. We are not receiving the enough oxygen. So fatty acid metabolism will be less, and we are producing the less ATP. That's why we requested to the heart, please let's use the fatty acid. Don't use the fatty acid. Instead of the fatty acid, we said use the glucose. Because even though less oxygen is there, even though less oxygen we are receiving, we can produce the enough ATP. Then our heart can work properly. That is what we said to the heart. But heart, what it is saying? Since childhood, since birth, I am using the fatty acid. Now you are saying suddenly use the glucose. I don't want to use the glucose, I will use the fatty acid only. That is said by the heart. Now what to do? So For requesting the heart, we sent one special person. What is the name of the special person? Trimetazidine. Trimetazidine. In the name itself is there, trimetazidine. In the name itself is there, we are having the meta. Meta means metabolism. This drug can change the metabolism. This drug can change the metabolism. Trimetazidine reach the heart. After reaching the heart, said, don't use the fatty acid. Then heart मान लिया, हार्ट सुन लिया था, ओके आप बोला है तो मैं फैटी एसिड को यूज नहीं करता हूं, अभी मैं यूज करता हूं ग्लूकोज को. So heart is start using the glucose now. Heart is start using the glucose. Heart is start using the glucose and produces the ATP. Even less oxygen is there. It is oxidized and producing the enough ATP. Then we are treating the symptoms. Then we can treat the symptoms. Indirectly, trimetazidine, what it is doing, inhibiting the fatty acid oxidation. Indirectly, trimetazidine inhibiting the beta oxidation of the fatty acid. So when the beta oxidation of the fatty acid is inhibited, heart start utilizing the glucose and producing the ATP, producing the enough ATP, then we are treating the symptoms. Now what is the question is asked? Which of the following is partial fatty oxidation inhibitor? So not nicardipine, not atosipam, not verapamil. Answer is the trimetazidine. So trimetazidine inhibiting the partial oxidation of the fatty acid. So heart is start utilizing the glucose and producing the ATP. Okay. Thank you everyone.